This video is going to look at cannabis and nausea. So the last one, you looked at cannabis and appetite, right? So let's imagine that your endocannabinoid system is dysregulated, and so you're eating a lot. And we talked about eating a whole lot of chocolate and cheeseburgers, and let's even throw in some of the high-fiber broccoli, and then you eat all that, what's going to happen? You're going to get nauseous. So what is the role of cannabis in nausea? So first we need to talk about what nausea and vomiting are. They're both natural responses that we receive through evolution to protect us against toxins. They are supposed to tell us that we ate something that is not good for our body, and then to vomit it out, to get it out of our body so that it doesn't get down further into our digestive tract where it can get absorbed. We know a lot about vomiting. We know what causes it, we know how to stop it, we know a lot of stuff about it. Nausea, we know very little about. And at first glance, you may think about nausea, well, it's not that big a deal. But research has shown that if you ask people to rate the pleasantness or unpleasantness of different human sensations, nausea actually comes out as the most unpleasant human sensation, even beating out pain. Nausea can be crippling, okay? It's not something you can usually just work through. Like pain, we have pain medications, we can reduce it to a level that we can still live our life. But nausea, it really wipes you out. And so, what's going on here? Both nausea and vomiting are very common side effects of chemotherapy. And in fact, the first medical use of THC in modern medicine, modern Western medicine, let me classify it that way, was in the early 80s, and it was used to treat nausea and vomiting due to chemotherapy. So there is a fair amount of evidence here. If we look at how well cannabis and THC work, THC is roughly equal to our current antiemetics. So emesis is the technical term for vomiting. So an antiemetic is something that prevents us from vomiting. We have very good antiemetics. They're serotonin blockers. Serotonin plays a role in vomiting. We'll see that later on. THC is roughly as equivalent to the serotonin blocker. So it is not some revelation out there that really helps advance the field. THC works to block acute, delayed, and anticipatory vomiting. So acute vomiting is if you ingest poison, you are immediately going to vomit it up. Delayed vomiting is when you ingest something that does not immediately induce acute vomiting, but later on you start to feel pretty bad. Maybe that sushi had been sitting out a little too long, and then you start to feel sick, and then you vomit it up. Those are both very relatable things. Anticipatory vomiting is, unless you've experienced it, not something relatable. So we mentioned that vomiting is a side effect of chemotherapy. These patients, they go in, they receive their chemotherapy, and the chemotherapy is usually injected, IV, and they suffer from acute vomiting. As the chemotherapy is entering their system, they start vomiting. They then go home, and they vomit potentially for days. That is delayed vomiting. However, the chemotherapy wears off. They feel better. They then have to go in for the next dose. And chemotherapy is usually administered in the hospital because it is IV and because it is so toxic. When they walk into the hospital, they start vomiting. This is anticipatory vomiting. Their brain connects that location with the bad effect that they previously had. I know what lecture this was. I don't think it was this course, but I told the story of how I ate empanadas at a gas station restaurant in Costa Rica and got very sick. To this day, when I see empanadas, I feel sick. I do not suffer from anticipatory vomiting. That would be anticipatory nausea. It is an aversive memory. My brain says, do not eat empanadas for the love of everything holy. Okay? Even though the empanadas that I would then be eating are probably perfectly safe. In order to achieve this antiemetic effect, we don't need very much THC. It is not enough THC to cause the psychoactive side effects. And so it works pretty well, but the serotonin blockers that we have already work quite well, and they don't really have negative side effects. And so it's kind of stay with the drug that you know rather than branching out and trying something new. It doesn't seem like it's going to be better. However, we do not have good treatments for nausea. They may have some effect, but they are not what we need to have. And in this situation, it appears that THC may work better than our current anti-nausea medications. So what is some science behind this? What do we find in animal studies? It's complicated because mice and rats are not able to vomit. And this may be something, most likely, is something you're not aware of unless you've done animal studies yourself. Because we can't use mice and rats to study vomiting, we can use ferrets and shrews. Now, we don't know nearly as much about ferrets and shrews as we do mice and rats. And so we can measure, does THC reduce vomiting in ferrets and shrews? And it does. And on top of that, we can see that if we give a CB1 antagonist along with THC, that we reverse that effect. We prevent the reduction in vomiting, meaning that THC is reducing vomiting through the CB1 receptor. And if you just take a ferret or a shrew, we give them a CB1 reverse agonist, it is going to induce vomiting. So it is very clear that the CB1 receptor has an action that reduces vomiting. And so if we reduce the basal level of activity of the CB1 receptor, we then allow this spontaneous vomiting to occur. Now, I mentioned that we don't have good nausea treatments. And that is largely due to the fact that we don't have an animal model to look at this. We can't take treatments and immediately put them into humans, right? We have to test them in animals first to make sure that it works and that it is safe. How do you know if a rat or a mouse or a ferret or a shrew is nauseous? You can't say, hey, Mickey, do you feel nauseous? On a scale of 1 to 10, how nauseous do you feel? It's not an objective thing. We can measure, did the ferret vomit or did it not? We cannot tell whether it is nauseous. We can possibly measure some behavioral changes. Maybe they eat less, maybe they're a little sluggish, but you don't know that that is due to them feeling nauseous. Very recently, people have found that compounds that we know induce nausea in humans through trial and error cause what we call gaping in rats. And so we have some pictures here of a rat and a shrew that are gaping. It looks like they're going to vomit, right? But we know that rats can't vomit. And so they just simply open their mouth. We call that gaping. And so we made the connection that rats and other rodents will gape when they are nauseous. So now we have an objective measure. And so now hopefully we can kind of advance the field of anti-nausea medicine. Because now that we see what rats do when they're nauseous, we can see that our current nausea treatments don't block anticipatory gaping. And so they're not blocking nausea in the rat. And so that kind of leads or kind of explains why they're not blocking nausea in humans. But CB1 agonists like THC block gaping in rats. And so it is not a large stretch to imagine that THC can reduce nausea in humans. Related to this, we can see that if we give cannabis chronically to rodents, like ferrets and shrews, in this case they're talking about vomiting, it can lead to hyperemesis. This is a condition where the animal will vomit uncontrollably over and over and over and over again. This is not something that we as humans will relate to, most likely. However, it is somewhat common in pregnancy. So if you are a woman who has been pregnant, it is possible that you have experience with hyperemesis. I know, I've heard it is completely debilitating. And so chronic cannabis can lead to that same effect. We know this. We don't know why, though. One hypothesis is that chronic cannabis use will lead to downregulation of the CB1 receptor, which is going to reduce endocannabinoid signaling, which could then lead to spontaneous vomiting, like we saw up here with the CB1 reverse agonist. What about CBD? We have not looked at CBD in humans in terms of nausea and vomiting. In shrews, we find that there's a biphasic effect. Low dose CBD decreases vomiting, high dose increases vomiting. The low dose of CBD is able to block both acute and anticipatory nausea. They haven't looked at the delayed nausea. And it's believed that it is working through blocking serotonin release. And interestingly, CBD is synergistic with THC in blocking both nausea and vomiting. Now, our hope at this point in the course, what we've learned, that seems odd, right? CBD normally antagonizes THC. It is a negative allosteric modulator of the CB1 receptor in terms of THC signaling, and just generally they have opposite effects, that CBD often reduces THC's effect. But in this case, for one reason or another, we don't quite know yet, they are synergistic with each other. What about some other cannabinoids? So THCA is THC acid, and CBDA is CBD acid. These are the precursors, the synthetic precursors to THC and CBD. They are present in cannabis until it is heated. When it is heated, all of the THCA and CBDA get converted into THC and CBD respectively. Interestingly though, the acid versions are more potent than the non-acid version. THCA is about 10 times more potent against nausea and vomiting than THC. The CBD acid form, 100 to 1,000 times more potent than CBD. And not only that, it is synergistic with our serotonin blockers. So we talked about serotonin blockers work quite well. THC works quite well to block vomiting. But CBDA is synergistic with our serotonin blockers. So potentially, we can take what we consider as being a good drug and make it that much better. There are some other cannabinoids. These are minor cannabinoids, THCV and CBDV, that reduce nausea, but most likely, in the long term, we're more likely to stick with THC and CBD and their acid forms. We just know more about them. CBG blocks CBD effects. So how does this relate to the endocannabinoid system? General anesthetics usually cause nausea. So patients undergo general anesthesia, they wake up, for a while they are nauseous. If we look at endocannabinoid levels in these patients, we see reduced AEA. And so it would seemingly be the case that AEA normal levels prevent nausea. And that when we undergo anesthesia or something else that causes nausea, it is reducing AEA levels, which then induce the nauseous feelings. Related to that, people who suffer from motion sickness see drops in AE8 levels while they are experiencing motion sickness. Those of us that do not suffer motion sickness don't see the same drop. So you can take two patients, put them in the same situation. One of them sees a drop in AE8 and suffers motion from motion sickness. The other one does not. That's interesting. FAH and MAGL inhibitors, these are going to increase endocannabinoid levels. They're going to have the same effect as exogenous cannabinoids. They block acute and anticipatory nausea in animals. I think this is the last slide. Yeah. So this is how this endocannabinoid system interacts with the brain in order to block nausea. So remember, the signals that cause nausea and vomiting at that are going to come from the GI tract. If we swallow something that is poisonous, our brain is not there to notice that, right? We don't go past the brain on the way down. So the GI is going to detect poison and is going to send a signal up to the brain. In order to get from the GI tract to the brain, it has to go through the brainstem. These signals specifically move through the area postrema and the parabrachial nuclei, and then move into the forebrain, particularly the interoceptive insular cortex. And once it's there, it increases serotonin release. Serotonin release causes nausea. While it is increasing serotonin levels, it is also increasing levels of 2-AG. Now, 2-AG is an endocannabinoid, which is going to reduce nausea and vomiting. And so this is a negative feedback loop. While the body is purposely inducing nausea and vomiting, it is activating a negative feedback loop so that this nausea and vomiting should be temporary and short-term and won't continue to get worse. So that is cannabis in nausea and vomiting. Very clearly, there is a potential role of use of cannabinoids, the endocannabinoid system, and the cannabinoids in preventing these moving forward.